to the One Society Network seminar series. My name is Ellen Rafferty, and I'm a health economist with the Institute of Health Economics and the project manager for the One Society Network, and we'll be moderating this event. So just really briefly, I know some of you might not have been able to attend our first event last, or I guess 2 weeks ago now, but we're one of a number of emerging infectious disease modeling networks, and the network consists of researchers from across Canada working to understand the broad multi-sectoral impacts of infectious diseases like COVID-19 and related public health policies. And really the goal of this seminar series is to give an overview of the dynamic connections between pandemics and diverse aspects of society. So if you're able to attend our one 2 weeks ago, I talked about kind of the macro economy and the impact the pandemic had on that. And today we're going to delve into the environment. So I hope you're really interested, because I am. Before we begin, some quick housekeeping items. So you'll notice you're muted and will be muted throughout the event, but feel free to use the chat to put in any comments you have to the group in general. We do ask that for any questions, you put those into the Q&A. So you'll see that at the bottom of your screen, and that just helps us kind of focus and organize the questions as we go on, and it doesn't get lost in the chat function. And we'll save about 10-15 minutes at the end of the presentation to have a discussion around those questions, but feel free to enter those questions throughout the presentation as they come to mind. So today's seminar, as you see on the screen, is titled Economics, the Environment, and the COVID-19 Pandemic, an Overview and Research Agenda. And please join me in welcoming our presenters, Dr. Vic Adamowicz, Dr. Patrick Lloyd-Smith, and Dr. Tsegaye Gatiso. And so Vic is the Vice Dean in the Faculty of Agriculture, Life and Environmental Sciences, and a distinguished university professor in the Department of Resource Economics and Environmental Sociology at the University of Alberta. He's also a fellow of the Royal Society of Canada, and his research has focused on economic evaluation of environmental amenities and ecosystem services, and the incorporation of environmental values into economic analysis, with applications to forestry, water quality, air quality, endangered species, and agriculture. Patrick is an assistant professor in water and resource economics at the Agriculture and Resource Economics Department, University of Saskatchewan. He is also a member of the Interdisciplinary Global Institute for Water Security and the Global Water Futures Research Program. Pat's research has focused on the valuation of environmental resources and the integration of these values into economic analysis. He has applied these methods to drinking water quality, agriculture externalities, human health impacts, and fisheries. And Tsegaye is an NSERC and One Society Network Post-Doctoral Fellow in the Department of Resource Economics and Environmental Sociology at the U of A. He received his PhD in economics from the Swedish University of Agriculture Sciences in May 2021. And his research broadly focuses on climate change, resilience, gender, environment, and development. And with that, I'll hand it over to Vic, who I think is leading off.
Great, thanks Ellen, and thanks everybody for coming today. It's a pleasure to be here on behalf of the team, and I know everybody will get a chance to speak. So I'm going to provide a bit of an introduction to the session today, and then I'll be back at the end to do a little bit of a wrap up. We're doing a bit of a tag team as we walk through. Let me get the slides going. So what are we going to try to cover today? I should say today's session is going to be maybe a little bit different than the excellent session that Chris Cotton and colleagues put on last time. And theirs was really nicely developed models and platforms and such. Ours is more of a work in progress. We've got some things on the go that we want to share with you, some ideas, and we're really looking for feedback and connections and other types of suggestions that you might have. So it's a bit of a different approach. I'm going to provide an overview of sort of where this linkage might be between economics, the environment, and COVID-19, and start really basic, like what on earth is an environmental economist anyway? and why are they interested in the issues around COVID-19. We're going to talk a bunch about thinking about health risk trade-offs, and I'll get into this in detail, but really a lot of what environmental economists think of are changes in environmental quality, of which one very common one is changes in air quality, for example, or water quality. And the linkage to human health is through health risk reductions. And so much of what we think about is how we should think about trade-offs and evaluations of changes that have an economic consequence, jobs, other things, but also have a health consequence. How would we measure those? How would we put them on the same units? And that's what we talk about, valuing mortality risk reductions and how we might actually incorporate health into the economic analysis that we're doing. So we'll talk a bit about that. We'll talk about some of the linkages that people have been finding within the environmental literature and tying that into the economics literature, so that either the pandemic itself, COVID-19, or the policies used to address COVID affect air quality. And those health risks are affected by air quality differences. So we'll talk a bit about that. How do we bring that into an economics realm? Amenity values that may affect outdoor recreation and environmental quality also have linkages with the pandemic and the policies to address the pandemic. And things like property values are tied in with environmental amenities and how people are responding to lockdowns and similar types of policy interventions. So all these things are really a bit of a tangled web, and we'll try to touch on each one of them and how environmental economists think about dealing with these types of issues. We'll give you a bit of our research plan and what we've been finding to date, and then we can have some discussion and some feedback. Okay, let me jump into, I don't want to make this a intensely boring economics lecture. I know it's a pretty diverse crowd that we have, or I suspect we do, listening. But just at the very highest level, when you think about economics, the standard kind of definition is it's the study of allocation of scarce resources. So how do people behave within markets or in places where they're making allocation decisions? How does that behavior inform us about their values? So that's economics at the highest level. Well, what's environmental economics? We really think about the natural environment as a scarce resource or something that's valuable to people. So how do people make decisions and behave in the context of environmental goods and services, as well as market goods and services and the types of decisions that they make? Because the environment, in a sense, is integrated into the kinds of decisions that we make. Now, part of this brings us into the realm of thinking about non-market behavior and values. Much of, for example, what Chris and colleagues talked about last week is really market behavior. So what are people doing in terms of jobs and consumption decisions and purchasing decisions where we have markets and we can see market transactions. But when we try to bring the environment in, air quality, scenic amenities, those types of environmental quality issues, they're not traded on markets. And so we've got both market and non-market behavior. They still show up in behavior because people may purchase houses that have nicer views and pay more for those. They may be looking for locations that are in cleaner spots in terms of air quality. So they still influence market behavior. We just have to do a little bit more digging on how that works. When we think about a policy change, if we're trying to evaluate a policy change by looking at the benefits and costs, we want to bring in both these market and non-market elements into that analysis. So again, we might have a particular policy that affects markets, prices go up, people consume less of something, but we may have the environment affected. How does that factor into the economic analysis? And lastly, environmental economists often are thinking about what we refer to as externalities. So something that is in either an individual's, that they're generating an action on others, or a firm is creating some kind of an outcome that they're not really taking into account directly in their decision making. So things like pollution, greenhouse gas emissions, those are types of externalities that environmental economists would think about. There's typically not a price sent to the firm to account for those types of external effects. And so somehow we have to think about a collective action or a policy that will try to address those externalities. So that's sort of very broadly what environmental economists think about, as well as other dimensions within that. Well, what's the linkage to COVID-19 and policy changes? Again, it's sort of the same issue. If we think about COVID-19 or the policies that have been tried to use to address COVID-19, they have market and non-market elements. And the market elements would be things like loss of economic activities, changes in jobs. But the non-market elements now could be multiple types. There could be health risk changes, and that's exactly why they're implemented. Well, those are not traded on markets. So how do we factor those values of health risk changes into this economic analysis? So that's one direct way that environmental economics and COVID economics, if you like, could be linked. There are also these linkages between economic behavior and the environment. So when we've had lockdowns in place, there's a reduction in transportation activity, in economic activity. That has an impact on air quality. It has an impact on traffic congestion. It has an impact on other things that are environmental in nature. So another way that the environment and COVID and economics interacts. And that third bullet, in a way, this goes back to the beginning, that this thinking about future pandemics, one of the concerns is that the state of our natural environment, biodiversity, wildlife interactions, those in a sense are a source of pandemics and have historically been a source of a number of zoonotic diseases. And think about our One Health and framing of these types of issues. Again, a linkage between the natural environment and health, but really as the origin of a particular pandemic. And finally, the fact that environmental economists are often engaged in thinking about policies to address these externalities, the kind of unintended consequences of effects associated with pollution, for example. There are a lot of parallels with COVID-19, that if an individual who is infected with COVID-19 or some illness goes into society, they may be thinking about their own particular actions and what it means for them, but they may not be factoring in the impact that they're having on others. And that's an externality. That's the classic negative externality situation. So how do we design policies? How do we think about the impacts of those policies? What are the dynamics around those policies? Are there expectations? Do people somehow adapt? How do they address these external outcomes? And how does some sort of a government policy then interact with those? So that's the linkage between environmental economists and COVID-19. This is a nice quote. We've been somewhat fortunate. This paper by Ashworth et al. is a very recent review of environmental economics and the COVID pandemic that just came out a month or two ago. And they think about it this way: what are the different paths of control measures, so lockdowns, vaccinations, whatever we can think of, that would minimize the sum of control costs, so the costs on the economy and such, and social costs, the fact that we will be, if we don't do these things, we will have illnesses, we will have mortalities. And so how do we minimize the sum of those in a very broad sense, looking at all the different pathways that address these kinds of issues? So that's a very broad introduction. Let me bring this back down to a bit more specifics that'll lead into what Tsegaye is going to be talking about. If we think about evaluating trade-offs between health and economic costs, so imagine we're just going to think about a specific lockdown. I'm using lockdown in a very generic sense, some sort of policy to reduce health risks. For environmental economists, this is quite similar to something like, we're going to reduce air pollution emissions. It has health effects. Hopefully, the air pollution reduction will improve health outcomes. So how do those things actually work in the environmental economics world? Well, one of the things we try to examine is the economic or monetary value of health risk reductions. That will then put us on an equal footing with the monetary costs of these types of policies. We'll be able to compare benefits and costs. We'll be able to examine who benefits and who loses. So we'll be looking at these that are called the mortality risk reduction values and morbidity risk reduction values. So these are very common in environmental economics, thinking about how can we apply those in a broader sense in the evaluation of COVID and what's the situation in Canada. Now, I will say as an aside, this can be a controversial area, so we maybe get into some discussion about this, but it's one of the topics that I think economists are thinking about worldwide. is how to better capture these different types of values of risks. With a policy, there's also co-benefits that could occur. Air quality may get better. We need to factor those types of things. On the other hand, there may be mental health impacts or other types of impacts on individuals from the policy. We'd like to factor those in, ideally capturing the costs and benefits of all of them. And of course, the opportunity costs of policies. So overall, we're looking for this linkage between economic behavior, health, values, valuation. And for us, this means a linkage between epidemiology, natural sciences, for those of us working in the environment, whether it's air or land resources, and tying it into the economic side of the story. So that's a very broad introduction. Hopefully I didn't drone on for too long, and I'll pass it over to Tsegaye to give you a few details on what we're thinking about, especially within this first topic of valuation of health effects. I'm just going to skip back. Actually, let me touch on a couple of these points. We've mentioned this air quality as one factor that there's evidence on within Canada. We'll bring up some discussion a little bit later on. Pat will talk as well about the linkage between some of the policies and recreation behavior, as well as property values. And we'll touch on at the end, if we have time, about the linkage between human-wildlife interactions and potential future pandemics, or if you wish, or some of the zoonotic diseases. Now let me pass it on to Tsegaye. Sorry, Tsegaye.
Thank you, Vic, and thank you, moderator. Good afternoon, everyone. I will briefly talk about our ongoing work on valuation of mortality risk reduction in Canada. The assessment of costs and benefits of policies and projects that involve changes in mortality involve economic valuation. And these values of mortality risk reduction measures individuals' trade-off between mortality risk and incomes. This is a very controversial issue, as highlighted by Vic earlier. It's controversial because of the critics that putting monetary values on lives may not be a relevant thing to do. And it's also very important to measure because these values of mortality risk reduction constitutes major proportion of the estimates of benefits of different environmental policies and regulations. In economics, we use two main approaches to measure values of mortality risk reduction. The first one is based on market, where analysts use trade-off between wage and mortality risk at job place, whereas non-market valuation approach asks individuals directly about their willingness to pay for small reduction in risk in a certain circumstance. So in Canada, Treasury Board Secretariat has suggested that governmental authorities use about $6 million to estimate values of mortality risk reduction. And this estimate is based on literature review by Chestnut conducted in 1999. This review has included studies both from United States and Canada, but this estimate was later updated by Chestnut and DeCivita in 2009. And in this later review, they emphasize studies conducted only in Canada, and that has been applied in different applications. For example, one of the applications was the recent estimation of health impact of pollution by Health Canada. As you can see from here, both estimates are based on all the studies and need to be updated to reflect the change in risk exposures and preferences in the society, as well as the growing values, for example, incomes and life expectancies in country that can affect the estimates of mortality risk reduction. One of the things I forgot to mention is that these measures of mortality risk reduction constitute this dominant part of the estimation of the benefits of health and environmental policies, especially those involving change in health effects, and it's one of the key parameters in policy analysis. So in this regard, we undertake a meta-analysis to update the estimates of value of mortality risk reduction in Canada. For this purpose, we conducted a systematic search of literature in main databases, and we also track citations in existing meta-analysis and select relevant studies to capture if there are any relevant studies that we didn't capture in our initial systematic search. After gathering all papers, we used three main criteria to screen the papers and select those papers that we include in our final analysis. One of the criteria is that the paper has to be conducted using a primary data from Canada. By using this criteria, we excluded papers conducted in other countries and those papers that simply extrapolate the estimate using the equivalent estimate from the United States. We also focus on papers that are published as peer-reviewed journal articles and those papers that explicitly estimate a value of mortality risk reduction or provide all necessary information required to calculate the value of mortality risk reduction. Using this procedure, we selected the final group of 18 primary studies from which we extract about 120 estimates of value of mortality risk reduction, excluding some outlier values which are above 50 million and below 20 million Canadian dollar. We use different approach to address some empirical issues in meta-analysis, and our results indicate that the main drivers of variations of these estimate across studies is the difference in the level of risks, the baseline risk they considered, and the amount of mortality risk reduction they valued. We also find that the studies based on data collected from a broader geographical area in Canada tend to report higher values of mortality risk reduction compared to those papers that focus only on specific places. And when we come to our main analysis, our results shows that the updated value of mortality risk reduction is about 40% higher than the one being currently used by Canadian authorities. As you can see in the table, our new estimate is about 12 million, which is well above the one suggested by Treasury Board Secretariat of Canada. But it also shows that the new estimate is closer to the value being used by governmental authorities in United States of America. And the underestimation of this value of mortality risk reduction may have some implications for the policies. Particularly, our new estimate shows that using the older or the existing official estimate of value of mortality risk reduction may lead to underestimation of the benefits of policies in environment and health sectors that involve reductions in mortality risks. What does this imply for the COVID-19 policy assessment? Well, one of the key messages from this is that it's important to get values of mortality risk reduction correctly defined and measured. This is important because it's required to do cost-benefit analysis of the policies pursued to control the pandemic. For example, the direct benefits from the lockdowns expressed in terms of the lives saved, and indirect costs of the lockdowns. For example, the economic impacts should be measured using the correct values. Another issue is that we need to also get the measurement of the co-benefits or unintended consequence of these policies. For example, the health impacts from the reduced air pollution should be valued using the correct estimates of the value of mortality reduction. For example, if we take the recent study, next slide, please. Yes, the recent study in Canada shows that the lockdown has improved air quality, which may generate some economic benefits, unintended economic benefits. As you can see from this table, there's a quite significant reduction in mean concentration of male air pollutants in Canada. But the exact effect of the health and economic effect of these changes or reductions in air pollution is not measured yet. So it's interesting research question for future studies to estimate the health benefits of these reduced emissions, and also to do disaggregated analysis to understand which layers, which rounds of lockdowns has contributed what amount of reduction in air pollution. So one of the mechanisms to estimate this is that using some standard economic approach of impact evaluation and integrating it with the special tool developed by Health Canada to measure air quality benefit assessment, we can estimate the effect of these changes in reduction in ambient air pollution and it is associated health effects. Finally, we can also value the economic benefits or costs of these health impacts, for example, expressed in terms of hospitalization or days. Then to highlight the point and illustrate the result, we took example from the recent report by Health Canada, where they estimated health impacts of air pollution in Canada between 2015 and 2017, which is of course before the COVID-19 pandemic. They estimated that the air pollution has resulted premature deaths over 15,000. And they also used the existing official values of mortality risk reduction and estimated the total economic cost, which is equivalent to about 120 billion Canadian dollar. But if we instead use the updated value of mortality risk reduction, this economic cost of premature deaths associated with air pollution will increase and it reaches over 185 billion Canadian dollars. This shows big difference and it highlights the need to update the existing value of mortality risk reduction. And it also indicates to choose the proper values to compare costs and benefits of the policies. So in choosing the level or the amount of mortality risk reduction to be used in policy analysts should consider some sensitivity of VSL value of mortality risk measures. One of the factors to be considered is the differences in age and also income. For example, the recent studies and discussions about the assessment of COVID-19 policies indicate that there is disproportionate effect of the pandemic, and there is a need to adjust the values of mortality reduction accordingly. For example, the risk of mortality from COVID-19 is skewed toward this older age and low-income groups. And to get clear picture of the costs of the pandemic and the effects of the policies, we need to take those heterogeneous effects into account to get clear picture. And before ending my part of talk, I want to mention some values which are missing from the conventional estimation of value of mortality risk reduction. These are morbidity and mental health effect, especially related with COVID-19. There is a recent study and discussion that found that the incorporation of morbidity effect or mental health effect into the estimation of the costs and the benefits of these policies has different results. For example, incorporation of morbidity in COVID-19 results in higher benefits of the control policies as compared to the estimates that omits the effect of morbidity in a pandemic situation. Having said this, I will end my talk here and hand the platform to Patrick for next talk. Thank you very much.
Great. So just kind of continuing on, I'm going to talk about two aspects of this interaction that Vic introduced between COVID-19 and COVID-19 policies and the environment. And so this is going to be recreation behavior and then property markets. And I think for both of these aspects, there's some interesting dynamics between the sort of market measures and non-market measures. And in particular, we're sort of interested in understanding how people's preferences for local amenities have changed. And I'll talk a little bit about how these methods are able to incorporate that into the analysis. And what we're hoping to do going forward is how can we provide insights and information and modeling frameworks for policymakers to incorporate the sort of perhaps changing values of local amenities in any sort of analysis of pandemic responses. So just starting with recreation behavior. So just on the kind of market side, outdoor recreation in Canada and the expenditures associated with that are fairly substantial. About just over 2% of Canada's GDP can be attributed to this sort of sector. But of course, most people participate in recreation activities, not to contribute to the economy, but for the sort of non-market benefits that they receive from that. So it's not so much the spending and the expenditures that they spend, but the benefits that they receive. So when we're going out to try and understand what the value of recreation and the access to local recreation is for people, we need to go beyond just what they're spending, but actually kind of develop different models to estimate the sort of benefits that they have. So we have these sort of recreation demand models that look at sort of the trade-offs and the decisions people are making about where they go to recreate, how many times, when they go, and looking at these different types of decisions, we can help understand what sort of aspects of their recreation trips or recreation experiences people value. So we have these recreation demand models. They've been used in Canada and throughout the world to understand the sort of value that Canadians and people receive from nature-based activities. The graph on the right of the screen there just shows for a whole host of different recreation activities in Canada, just the sort of value per day that people are receiving from participating in these activities. And this tends to be about twice as much as the expenditures that they're spending. So as often brought up, it's sort of the spending that people have is perhaps not the best measure of the benefits that they receive. So we need to use these different types of models to estimate those benefits. So there's been a lot of changes and travel restrictions and whole host of different policies implemented over the last couple of years, looking outside of Canada for what have people seen. So this is some work that was done in the UK and just trying to understand how travel restrictions have led to changes in behavior. So in this case, these travel restrictions have kind of caused sort of more of a substitution from people taking longer trips or further away from their homes to much shorter localized trips. And in addition, not just sort of understanding that behavior, but building these sort of modeling frameworks so that when policymakers are making these decisions on what sort of travel restrictions that they might want to implement, we have all the sort of health side, but what are the sort of implications for recreation activity? So that's what we've seen in the UK. In Canada, some people have consider using some Google mobility data. So there's a lot more sort of passive tracking data on our phones and in different applications that people use. And so you can see on the graph here, this is for different types of activities, what has sort of been the change in the Google mobility data. And you sort of have these sort of peaks there or sort of trips to parks. So maybe a sort of initial understanding that maybe these sort of trips have changed. But just a couple of caveats with this data. There's no pre-2020 data, so we don't know what was happening before. And you can see sort of a clear seasonality where, you know, Canada is a northern nation. There's a lot more sort of mobility trips to parks in the summertime compared to wintertime. So it's hard to use this data when we don't have that sort of past pre-pandemic baseline data. So some other data that we're looking at to, again, help build up this recreation model story is there's some data we have on camping reservations in Alberta. And if anyone's sort of tried to go camping in the last couple of years, you've probably had some challenges finding your favorite spot, or there's quite a sort of hefty demand for it. And so this graph here just shows reservations sort of normalized to 100 in 2014. So it's sort of been bouncing around for a few years. And then we see that big jump up, about 35% increase in 2020 compared to before. Not all of that can be just attributed to just the pandemic, but we're sort of interested in untangling sort of some of these causes of that sort of change in behavior. And this is happening when a lot of campgrounds had capacity restrictions. So a lot of campgrounds were at about 50% capacity. And so we're interested in how has this sort of pandemic travel restrictions, people can't travel internationally, people are maybe taking more localized trips. How has that sort of changed the value of these natural areas that are closer to home, as well as what are sort of some of the management implications going forward when we have a lot more people accessing these natural areas. So that's on the sort of recreation side, and you can see it sort of extends from that sort of market activity to these sort of non-market benefits. And then I just want to end off briefly talking about property markets. So that's sort of another way that we can study people's behavior. In this case, it's in the decisions of which home or apartment to purchase or rent, and to learn about how people are valuing local amenities. So people are buying homes for a whole host of different reasons: number of bedrooms, square footage, and perhaps access to local areas. Maybe there's a park nearby, access to water. And I think, you know, people have probably all heard anecdotes of this sort of rush to green or rush outside of the cities since the pandemic occurred. And so we kind of think maybe, well, the value or the benefit of living closer to green space has perhaps gone up during this pandemic, as people have sort of left the cities with all these pandemic restrictions and different policies implemented, as well as just people's preferences overall. But some of the preliminary evidence, and I should really highlight how preliminary this is sort of that initial kind of rapid COVID research that happened. So it's probably only about 6 months to a year of data, suggests from the US as well as New Zealand that that might not be the case. Maybe there actually hasn't been an increase in the sort of value of living near an open space, and perhaps decrease or maybe just no effect. So I think that sort of preliminary evidence suggests maybe some caution is warranted of just sort of thinking that sort of the value of green space has just gone up automatically through this pandemic. So what we're hoping to do here is use sort of property market data in Canada to help kind of build up this story of how has the sort of value of local amenities, open space and parks being one of the more important ones, how has that perhaps changed? And then going forward, again, similar story, what are sort of the management implications going forward from the modeling side. So that was just sort of a very brief on sort of two aspects of these linkages that we're interested in, recreation and property markets. And I'll hand it back to Vic.
Great, thanks, Pat and Tsegaye. So I'm going to finish off with maybe a bit of a stretch, but maybe get some of our thinking going on another topic, and that's future pandemic risks and the environment. You know, most of our thinking and our work plan is around understanding the effects of the current pandemic and the policy options to address that, some of the behavioral linkages with the environment. But just as a bit of a teaser, the environment is potentially the source of future pandemic risks. And there was a very recent article that came out in Science Advances on the costs and benefits of preventing future zoonotic pandemics. A few of our colleagues worked on this. I just want to highlight one chunk out of this paper that says current swine disease in China and Southwest Asia and continuing spread of chronic wasting disease in the United States are only a handful of mutations away from triggering a pandemic. So maybe this gets our thought process going. It's not only looking at the current issues, but how do we think about modeling these future issues? And chronic wasting disease is not only in the United States. This is one of the recent maps on the spread of chronic wasting disease. The origins were in some of those dark brown, dark gray areas, but it has spread widely in Western Canada. Prevalence levels are very high in Alberta, recently emerged in Manitoba. So again, how do we think about this? Reaching out to our colleagues in epidemiology. We've been studying the recreational behavior, hunting behavior associated with this for about 15 years. So we have many years of data and interest. What have we been learning from that? Well, first of all, just back on the prevalence levels. In Alberta itself, we have certain regions of the province where 40% chronic wasting disease, I should say, affects deer populations, elk populations, moose populations. In Western Canada, mostly deer populations. In some of these regions in Alberta, 30 to 40% of the deer harvested and submitted for testing actually are positive for chronic wasting disease. There's no evidence that it's zoonotic yet, but it's stated as potentially zoonotic. You can see the prevalence levels on the increase. And maybe we need to think a little bit about this somewhere down the road. In terms of behavior, most folks have not changed their behavior in terms of hunting and consumption of harvested deer meat associated with deer hunting. So we've seen that consumption pattern continue. Pat mentioned that there were increases in camping demand because of the pandemic. We see a different story in this type of recreation behavior. These are actually some of our recent surveys. We sample about 10,000 recreational hunters in a year. Most folks are not changing in response to the pandemic, so that particular activity does not appear to be sensitive. Those who are, some are hunting less, partly because they can't afford it. That's one of the statements for why they're hunting less. Some are hunting more because deer meat is a relatively inexpensive source of meat, and we've seen some of the food impacts and food price impacts on the other side on agriculture. So much of a kind of tangled web in here between health risks, economic behavior, non-market elements like recreational hunting, as well as food safety issues. And just to kind of make this an even bigger mess and perhaps an even more fascinating situation, deer have COVID. So there's studies from across North America showing that deer populations are potentially reservoirs of COVID. Some recent studies even out of Eastern Canada that show this. So maybe just a little bit of a thought for things that we could think about down the road. Maybe the lessons we learned from COVID-19, how might we prepare if some other case like chronic wasting disease actually does emerge as zoonotic? Let me wrap up. So you've heard a little bit about what we're thinking about doing with these major areas, this kind of connection between market behavior and non-market components. Air quality is one. I noticed there's a question in the Q&A about thinking about public transit. In fact, that whole transportation aspect is an interesting one that'll be in that air quality pollution component that I think it'll show up in the data. How we study it specifically is a really interesting question. The one that Pat touched on amenity values and impacts associated with restrictions, whether it's recreational activities and the amenity values associated with nature, or property values and how they're affected, nature conservation activities, recreational hunting and such, and broadly informing these future policy analyses. Now that's kind of a big picture swath of what we're thinking about, and looks like we've got a few questions and a few minutes as well that we've saved ourselves some time for Q&A. So thanks very much for listening. I don't know, Ellen, should we just address each one of these that's in the chat box as a good way to start, or in the Q&A box?
Yeah, how about I read them out, just because I don't think everybody can see the Q&A
Okay.
box, and then we can address them one by one, because I think there's some great questions in the
Perfect.
chat.
Perfect.
So the first one from Michael Donahue, one of the interesting and controversial topics of debate of BMRR is whether type of risk matters as well as size of risk. That is, should a 0.01% risk of death from cancer be worse than a 0.01% risk of death from an auto accident or a terrorist attack, or so forth. In the context of COVID-19 pandemic, have you looked at using a differentiated BMRR where a COVID death is valued more or less than an air pollution death?
Well, let me take a stab at this one first, and then I'll open it up for my colleagues. And thanks for the question, Michael. So we haven't done anything like that yet, but we're certainly looking at the literature. And to be honest, I've seen discussions going either direction, that the context associated with COVID should result in a higher value, and some are saying it should result in a lower value. To be honest, I think that the jury's still out even on some of the other risk context changes, but that's definitely an interesting and important area of research. I'm actually going to tie it into the next question, which is, do policy decisions generally account for morbidity costs apart from mortality associated with these damages? The answer to that one is, if they don't, they should. Now, morbidity is, in many of the air quality studies, for example, it's a relatively low fraction. What some evidence is suggesting on the COVID side is that morbidity may be a much larger proportion. When we think about morbidity associated with long COVID and some of the other sorts of stress and dread issues of COVID, some estimates have suggested that the morbidity costs of COVID are as high as the mortality costs per case. Now, that would really change the benefit cost analysis. That would dramatically increase the benefits of a risk reduction policy. So I think the context issue is really interesting, and the context issue probably applies more to the case of morbidities than it does to the mortality sense. So I'll pause there. Pat or Tsegaye, any thoughts on that one?
Yeah, I can say a few points about the first one. In our data, we have information about the source of those risks, and I think we can see if the context matters in our empirical specification. So that's interesting to see that. And the other comment is, as mentioned by Vic, it's up to for like future research, because in our papers we don't have any study related with COVID, so we need to plan or see if there are any future things that we can do to compare if days from COVID or days from air pollution, and which one matters most for people's point of view.
Yeah, and I'd maybe add as well, I think it raises sort of, I like to think of it in two parts. I mean, one is sort of, does risk context matter? And, you look at the empirical evidence from these different studies, and I think there's some to suggest that it does. And then just sort of from a public policy perspective, should we be sort of valuing these different risk reductions differently? And I think that's sort of this central role of ethics that's always been a part of this discussion. And one of the reasons why governments, essentially most governments around the world, have used sort of a single value for mortality risk reduction, even though there is empirical evidence to suggest that's going to depend on not just maybe the risk context, but also other aspects of individuals as well. So I think it's sort of an interesting discussion, both do we see it in the data, but then if we do, if we do we actually adopt a different sort of values when we do sort of public policy evaluation.
Yep, great points by both.
Great, thank you. So the next question is from Jean-Michel. Any insights whether the decrease in property values closer to green/open spaces might be linked to increased visitation and crowding effects?
Yeah, I'll take that one. I think that's a really interesting sort of potential mechanism for why there's maybe that decrease or no effect, or you might be having these sort of countervailing effects in property markets. Again, those initial studies were, quite rapidly done. So I think, it'll be interesting to kind of look now that we have sort of a couple years of property sales data to kind of get a better sense of how people's choices have changed and sort of preferences, because buying a home is sort of quite a big life decision. So, it's what we see initially, what we see now might be a little different, but I don't think those studies have sort of explored those mechanisms, but it's definitely something interesting to consider.
Yeah, agreed. And one would hypothesize that might be the case, that in certain local areas, one could imagine the kind of congestion effect arising. But I haven't seen any actual work that teases that out. And congestion's a kind of nasty one to try to identify statistically in data what the impact of it is. But yeah, it's definitely an interesting consideration.
Great. So the next question from David Hall. The CWD research is really interesting. Have you examined how peer group and norm influence beliefs, re likelihood of CWD to become zoonotic?
Yeah, I'll take that one, at least to start. We haven't done it formally, but I think definitely there's a connection. I know some of the work in the US on CWD and perceptions and beliefs does tie in norms and different social backgrounds, et cetera. So I think that is a piece. I think a lot of it is information provision, information processing. That's something else even when we're engaging with participants in these activities, how they're sort of framing chronic wasting disease. I think one of the other things is that there's just a wide array of diversity in perceptions and beliefs of risks within the community. So, much like any of these health risk questions, there seem to be very diverse risks perceptions, and we see that within the chronic wasting disease area as well. And that manifests itself in behavior. We know that some individuals have stopped hunting because of chronic wasting disease. Other individuals are not affected at all by it in terms of their economic behavior.
Great, thank you. We had a question from Eric that I think you answered in the chat, but just might be easier if everybody sees it. So Eric asked, do the policy decisions in relationship to environmental impacts include an analysis of the rapid proliferation of disposable healthcare PPE, masks, plastic barriers in social commercial spaces that will now have to be disposed of?
Yeah, and I can jump in on that one too. I mean, the answer is that yes, they should. I've actually seen a study in Canada. Tsegaye, I know you may have looked at some of those. That is an issue that's come up, the waste management aspects, the costs of additional waste processing. But that might be something to consider and see if we can incorporate into some of our work.
Okay, and I had a question about how VMRR has been kind of incorporated into FE models, or is that something that's happening? Is it something that should happen? Is there a risk with doing that? Yeah.
I'll start with that one. Others can jump in. This seems to be the order of the day. I would say what's happened right now is that the EPI models and kind of VMRR have just been stuck together, that they've been applied, and even some people within our network, Carolyn Fisher, for example, has taken an SIR model and integrated values mortality risk reductions into it and applied some analysis of heterogeneity. So I'd say they're blended for now. What would be really interesting is to try to integrate them even more, because to a certain extent, the mortality risk reduction values are an assessment of how people are perceiving risk, or they could be viewed as how people are perceiving risk. And one could see that as one of the ways that VMRR and EPI models could be linked together. I don't know if you got any, Pat?
Yeah, I'll just add quickly. I mean, I think there's always a challenge when you kind of integrate more models, but another opportunity that's been done in, again, related more to the air quality, but just looking at sort of human capital models. So looking at these sort of impacts on human health, but through sort of a human capital framework to understanding sort of how that implicates sort of labor supply, and perhaps even back to some of the work that was discussed in the previous sort of macroeconomics literature. So again, these are sort of tend to be quite large models that have them all, but I think there's some sort of fruitful insights to gain from that, and not just sort of this partial equilibrium or just kind of incorporating a dollar value at the sort of end of the analysis.
Mm-hmm. Yep, good point.
Perfect. I think that's all the questions we have, and it's good timing because we're looking to wrap up. So if there are no other questions that are coming through, I just want to thank everyone for attending and thank our presenters, Vic, Patrick, Tsegaye. It was great to have you. As we said in the chat, if you have any further questions or wish to collaborate, feel free to reach us at theonesocietynetwork.ca or at our email address. And we can also kind of put you in touch with Patrick and Vic and Tsegaye if you have any further questions. Thank you, everyone.